All right, Angelica, thanks so much for doing this. Just first off, tell the audience, tell me a little bit about yourself and how you got started in physical therapy.
Yeah, thank you for having me. I really appreciate it. So, how I got started in physical therapy, it starts from just basically being an athlete. I ran track most of my life, and I always thought that I wanted to treat athletes. That was like the main thing. I thought that would be my connection to staying in that community essentially. And then basically, once I got into PT school, I realized that was the last thing that I wanted to do. I just realized as an athlete myself, going through college, the amount of resources that I had, I mean, at my fingertips was, it felt like, I mean, I had everything pretty much. And I realized that I cared more about specifically more underserved populations. That's what really spoke to me, whether that was women or, other minority groups. Being a Black woman myself, that just really spoke to more of what I wanted to do and really what I was passionate about. So as I was exposed more to pelvic health in PT school, that's what really spoke to me.
Mm-hmm.
Yeah.
And what goes on in like pelvic health? Because that's kind of like your specialty. How is that sort of what what do I need to know about it, or what can the audience learn about pelvic health and how it's tied to PT, physical therapy?
Yeah, that's a great question. So it's a loaded question, but I'll try to unpack it a little bit. Every person, like any person, has a pelvic floor essentially, and your pelvic floor helps you essentially be able to participate in in bladder function, bowel function, and sexual health function. Essentially, those are some of its like critical roles. I often tell people just to keep it like very simple. Your pelvic floor helps you pee, poop, procreate, and birth with ease if you are a birthing person. And so, how that can really manifest in physical therapy is yes, those sexual health issues, whether it's like pain with intimacy, however that looks, whether it's outer course or intercourse. Whether it's bladder issues such as incontinence, whether you're leaking urine basically with coughing, laughing, sneezing, or you're suddenly having this urgency to go and you're leaking on the way, or you just have frequent urination, bowel issues such as constipation or incontinence in that sense too, whether that's seepage of gas or um, leaking with running. Like there's different types of leaking essentially that can happen, but that's how it can manifest. That's like one realm, but also pelvic floor issues can often present as hip pain. They can present as back pain, a tailbone issue that's kind of nagging that's been around, sacral issues, and we see that a lot in the like postpartum realm, the prenatal and postpartum realm. So like perinatal realm. That's where we see a lot of pelvic health issues, but it exists beyond that, and also. Um, like I said, all people have pelvic floors. It's not just like women. That's what often the thought is, or those with vulvas, I should say. It's not just that. There's penis owners who have pelvic floor issues too.
Mm-hmm. And so what are the physical therapy sessions look like? Like a patient comes in with like a back pain or other pelvic issues. How does
Mhm.
that sort of go down?
Great question. So we do some of the traditional things that you would see in a typical physical therapy office, like a traditional outpatient physical therapy office. So we're going to do a movement assessment. We're going to look at how you're moving, like globally, from your spine to your hips to your pelvic girdle itself. Sometimes knees, ankles, like we consider all those things. That's what we're going to do all together. But then pelvic health is a little bit different in that most of us, ideally, are performing some sort of external and internal pelvic floor muscle evaluation, which can be which can present the same way as a pelvic exam, what people understand to be a pelvic exam, but it's different in that we are the musculoskeletal experts is basically, and we're neuromuscular experts. So we really care about the muscles and the structures within the pelvic floor that really support like function and dynamic ability and physiological movement. So we're going to assess like your pelvic floor muscles, that connective tissue that we have, like fascia, ligaments, tendons, and then really consider like nerves and how they contribute to muscle function. So we do something that's similar to an internal, we call it an internal muscle evaluation. It presents similar to a pelvic exam that you would see in an OBGYN office. And then sessions can include so many things. We do a lot of manual therapy. We're literally getting our hands on people to assess their pelvic floors internally, externally, and their entire body. and we treat that way too, but we also do lots of exercise. So we're assessing all the deficits that we would see for any person and treating those deficits that we would see related to the spine, related to the hips, the pelvis specifically. Um, yeah, there's a wide array of things. It's we think about the body very holistically, so we're assessing someone's breathing and their abdominal wall. That's a huge part of what we do because your diaphragm and pelvic floor are pretty much mirroring each other. They are one and the same, honestly. So if your breathing mechanics aren't ideal, then your pelvic floor mechanics and function will more than likely not be ideal as well.
Mm-hmm. So, but like, how does that apply to someone with, let's say, for example, a spinal cord injury or someone with cerebral palsy? How would the pelvic floor exercise be conducted for that individual?
That's a great question. So many people, depending on like what spinal level is involved with the spinal cord injury specifically, they may have, bladder or bowel sort of issues or dysfunctions there. And so pelvic health can be helpful as far as like discussing what we would call toileting management and helping someone um, be able to navigate that kind of dysfunction, I would say. So there's lots of education involved and then also, depending on how someone's pelvic floor muscles would be involved, again, depending on the spinal level that is in question, we could talk about strengthening those muscles. We could talk about accommodations related to bowel and bladder management as well. So it varies. It really just depends on how someone is functioning. It's all boils down to like muscles, and typically people with cerebral palsy have some sort of dysfunction or weakness related to muscles. And so it depends on the presentation, to be quite honest with you. I've seen people who have multiple sclerosis who are dealing with incontinence issues um, for whatever reason. And so because it is a neurological condition, that's another area that pelvic health PTs can be very helpful as well.
Mm-hmm. And how do you sort of help those folks, achieve that independence? Because oftentimes what works for one person may work differently for someone else.
Yeah, it depends on what their goals are, It depends on what their goals are, what they want to accomplish within the session. So we typically establish that from the beginning. Like, what are you trying to achieve? Because that's going to really guide our entire plan of care with you. So every person is different. That's what I can say. It varies so much. No clients are the same. I've been doing this for, quite a few years now at this point, and nobody's the same. They can have a similar symptom, but their presentation of their pelvic floor may not be the same. And there's often this thought that, if you're anything pelvic floor related, it's like do Kegels, whatever, pelvic floor muscle contractions, that's what we call them. And it's a lot bigger than that. It's a lot bigger than that. That is just like one intervention for some people, and that's like the last intervention for other people. And oftentimes it's a combination of things that we're doing to really address someone's symptoms. But we don't want muscles, and this goes for muscles in general. I talk about this with my clients all the time. You don't want any muscles that are at their baseline just resting, like you and me here talking. You don't want any muscle that's like just severely tight, and you don't want any muscle that's like overly lax, kind of stretched out. We want our muscles to be like in the middle and happy because that's where they are the most functional for us. That's where they are the most strong for us. That's the ideal. So, muscles, you can have symptoms if your muscles are too tight, or if your muscles are too lax, or if they're uncoordinated, essentially. And that's kind of how we approach people. You can have symptoms based on those presentations.
Mm-hmm. And what have you learned in doing this kind of work? What was the most, I guess, rewarding in doing this kind of work in pelvic therapy? And what has
Yeah.
been like your most challenging or most difficult that you've during your work in pelvic therapy?
That's a great question. The most rewarding is for me, I would say just being a part of people's journeys, like having them sit in front of me and tell me their stories and making their not even just stories, like their history. I don't want to call it a story, their accounts, their experiences, and really getting to just like listen to them and help them figure out the root cause of their symptoms. Like that's what we're doing basically, like root cause analysis of why you have these symptoms and why you've had them for this many years and where did it come from and what how did it start and that sort of thing. So I think that's the most rewarding part is that I get to spend a lot of time with people, like so much. I get very close with my clients and I feel very grateful in that, which is why I also became a physical therapist in the first place and then took it even deeper into pelvic health PT. So I think it's just being able to help them connect dots for themselves because like I'm not the fixer, I'm not the healer, but I can help walk alongside you and help you really get to what the issue is. And yes, we have a skill set to help yeah address these things and people are coming because they want these symptoms to be resolved, but it's really being a part of the journey and them like opening up and figuring out what's going on with them and helping them make sense of it, especially when we're talking about pain. That's more of, I would say, my specialty. I love treating acute and chronic pelvic pain because it's so involved. It's not just this physical thing that happens, it's this mental, emotional, spiritual thing that is going on, and our nervous system is often impacted, and how can we really parse that out and get to the root and get to the other side of it. So that's what I would say is the most rewarding, but at the same time that can be the most challenging because there's a complexity there of figuring out what exactly is going on with this person's body, their pelvic floor, their nervous system, and figuring out you know, all the things outside of the clinic that could be playing a role with them as they present to me in the clinic as well. That's that I would say is the challenging piece sometimes is like people aren't always comfortable thinking about or thinking outside of the box about themselves and figuring out what's happening. And I think it's very important to talk about, all the little stressors that we have that could be contributing to a symptom or how we present today as they're seeking, care for whatever their issue is.
And um, which brings me to my next question. Like, how do you when it comes to like pelvic floor therapy, like, um, what can be done to sort of like educate them like on how to better strengthen their pelvic floor and kind of do the most of it like because you said you don't want it to be too
Hmm.
there's a risk for muscles to be too tight or too
Yeah.
lax, and so how do you go about doing that?
Yeah, that's a great question. I mean, my number one is gonna be like is me saying literally everyone should see a pelvic health PT. Like you should just get an idea of how your body presents because it is going to change and your pelvic floor fluctuates with what you're doing, the demand on it, the demand you put on it, the volume of activity. And then um those of us who are vulva owners, like um how your reproductive system may change, right? All those things matter because if we're talking about just hormones, hormones affect your pelvic floor. Um, Hormones affect your pelvic floor too. So we have to make those sort of considerations. But number one thing, oftentimes, that we are telling people to do and showing them how to do is to just like be in tune with themselves and their body and what they are feeling. And one way that we do that is diaphragmatic breathing. Like that can go a long way with a lot of issues. You, I urge everyone to like think about all the things that they do in the day and how many times they may be holding their breath when they're just like exerting themselves, and then also all the times that you may be clenching your body and not even notice it. Like, are you clenching your abdomen? Are you clenching your jaw? Are you clenching your shoulders, right? A lot of us spend time in front of a computer. All of those things can play a role and really enhance like tension within our body, and our pelvic floor is just another place. That's what makes it so inherently different than other parts of our body, is that your pelvic floor has what we call motor nerves that like help us move literally, and then sensory nerves so that we can feel, but it's also part of our autonomic nervous system specifically, so that like rest and digest and like fight or flight sort of symptoms, it has innervations of that. So that's what makes it a little bit different than a lot of other places. It's highly emotional. It's highly emotional. So it can be affected by how we are feeling, how we felt that day, how we've been feeling for this week, this past year, this past month, whatever the case may be. And so diaphragmatic breathing is one beautiful way that you can one impact your nervous system and help really um, improve, whether it is upregulated or not, especially in this day and age. There's so much happening, especially since the pandemic. A lot of us need to ideally learn how to down train our nervous systems. And then also, diaphragmatic breathing is helpful for the pelvic floor. If somebody's dealing with more of a tense, tight pelvic floor, it helps literally lengthen it. It creates that mobility there and improves, therefore, the function of your pelvic floor. But to bring it back um, to breathing and holding your breath, if you are holding your breath all day, that's going to impact your pelvic floor and how it functions. And you could be stressing it more than ideal if you're lifting weights, if you're lifting your child, if you're pushing a cart, if you're moving, you're picking up a couch, whatever, you could be impacting those organs more than those organs, and then therefore your pelvic floor muscles and connective tissue more than you even realize.
I did not know that. I
Right.
will take that into
Please
consideration next
do.
time. Yeah.
Yeah.
All right. So, in terms of like learning something new in your role in pelvic therapy, what do you hope to learn? Is there like something new or like a population that you want to look at or anything along those lines?
That's a beautiful question. I always say like if I wasn't a pelvic health PT, I would probably be a neuro PT specifically. Like I would work in a rehab center probably full time. And I loved when I was in school, actually treating, it's funny that you brought that up, treating people who do have spinal cord injuries or multiple sclerosis or Parkinson's disease. I was so intrigued with that realm of the PT world that's something I'm always intrigued by and would love to know and learn more about. In pelvic health, I feel like I get a good mix of that because there are a lot of nerve issues and conditions, neuralgias that present within the pelvic floor, something called pudendal neuralgia specifically, and I'm highly intrigued by that and always want to know more about it. I'm always taking like deep dives on that. So I always want to know more about neurological conditions, I would say. And then two, right now I'm actually going through an integrative women's health coaching certification to just learn more about um, the body holistically and how it presents and hormones and even more about the nervous system and just like gut health and how our gut is truly our second brain and houses so much of our immune system, and our immune system is connected to our nervous system. So I'm doing that right now to really be able to serve my clients in a deeper and better way and speak to many of the things that they come to us with. So that's what my focus is right now. Is just being more holistic, being even more integrative within the way that I practice.
And what tips, advice would you give to those who are wanting to study pelvic health? Because I'm not sure what your journey was like getting to where you are
Oh,
today, but could you talk a little bit about that?
yeah, absolutely. So, um, yeah, my pelvic health journey, I did not realize that I want to do pelvic health until I was in basically my second year of PT school. And at that point, all of my clinical rotations were pretty much set in stone. So I just started shadowing in ways that I could, shadowing pelvic health PT. So that's my tip number one. I would say just find a pelvic health PT, shadow them, see what it looks like, and find many. Like we all don't practice the same. That's just like the world in general, right? You see one attorney versus another attorney, you might see different things. Same thing for physical therapists. We all don't practice the same. So find multiple and look at their practice and what their specialty is and what populations they like to treat. I say shadow, number one. Um, and then to be more specific with PT specifically, t- I basically I was just talking about this. It's so funny, but I basically left PT school because we don't get a whole bunch of pelvic health anything in PT school. I was lucky at my school that we had a specialty topic basically on this, so I had an 8 hour lecture and lab situation to know more like truly how to examine and get an idea of the pelvic floor. But I took a lot of courses. Like I just took a lot of continuing education courses in my first 5 years of practice. That's like what I did. I left PT school and just took more courses. I went to PT school for pelvic health. It was like my own journey of doing that and listening to podcasts and finding research on my own and just like being open every day and putting my ego down and just saying now's the time to truly just learn and get in there. Like I want to just be okay with being uncomfortable, literally. They teach you that in PT school specifically, and I that really resonates with me now. But just getting in there and taking the initiative to learn and learn on your own is super super important. But I would say con ed classes and having a mentor, that felt vital to me when I got out of school. I didn't have like an immediate one just in the way that I was practicing, and so I literally left one job to like get a mentor or two. Like that's what happened. I wanted one daily so that I could go talk to them, and I think that is so important. That's so critical. They have to be a great mentor, but it's just nice to have someone to bounce ideas off of. Like you got to go in there and just get it and make sense of it and think and push yourself and stretch your brain, but also having a mentor to just bounce ideas off of and give you some guidance. I think it's pivotal. It's vital. So lots of Con Ed courses, and then I did this about a year and a half ago. I became board certified, and I did that very purposefully because I knew that it forced me to really like get into the research, and this is incontinence, this is the best way to treat it, or this is pain with intimacy, this is the best way to treat it, or this is diastasis recti, this is the best way to treat it from a research standpoint. And we know that research often lags behind from the things that we're doing in clinic because we're in it, we're in the thick of it, and research takes some time to catch up. But I did that specifically so that I could really have my pulse on this is, the standardized way of treating this, and that's great, and I know it, and that's how I can use it, apply it, but then how can I also stretch this and turn this and manipulate this for this specific client based on my experience and their values and their expectations, because no one person is the same. So that was a process too that took that was like me working and studying for about 7 or 8 months, sitting down, taking a test, a very long test, and then thanking God that I passed it. Um, and then, yeah, here I am, but still studying, still loving to learn. Like that's what that process was for me. It was just like a structured process of studying. Now that I've been practicing for a few years, let me think about all that I've learned at this point and integrate it with this research and then take it into the clinic so I can be even more efficient with what I'm doing. So
Mm-hmm.
that's been my personal process.
Mm-hmm. All righty.